And so what's in the IV? It's a large amount of vitamin C. So 25,000 milligrams of vitamin C is not what you need on a daily basis to get your vitamin C level up. What we're doing is flooding your system with a nutrient, an antioxidant, and it's altering the electrons on your cell membranes. And as you alter the electrons on the cell membrane, you're actually allowing your own immune cells to penetrate each and every cell in your body. So for now, you don't feel any problem, and we're doing this more of a preventative, because when you put people on a program to detoxify the liver, boost the antioxidant function, you're actually elongating the telomere. At the very least, slowing down the process of shortening the telomere. And for people who don't know what a telomere is and its measurement is relevant to your biological age. So when you're born, your telomere is long. Every cell division, your telomere gets shorter as it's repairing the DNA. So by the time you're 90, it's very short. So when we measure somebody's telomere, we're really getting their biological age. So this combination amongst many of the lifestyle changes, we have been able to demonstrate that we can slow down the aging process. We can make the telomere longer and at the very least have a healthy aging. Now, what's in the vitamin C? We talked about the vitamin C. We talked about B complex, B12. Those are good for metabolism. They're good for detoxification. Glutathione is the most powerful antioxidant. Your liver makes it. It makes it because it can detoxify. It can boost the immune system. It is part of almost every system in your body. So when you eat something, except for things which are eliminated from your body when you go to the bathroom, it has to get absorbed into the bloodstream. From that, it has to go through the liver. And it makes sense, because if the liver cannot process and eliminate things which are harmful, you're going to get into a bad state. So we're giving him a bolus of glutathione, which some people say, well, there's nothing wrong with his liver. You don't have to wait for something to be wrong. Is your liver 100% functional? These are questions that I believe we can demonstrate for people. And the conventional thought is wait for the liver to be damaged and then do it. And I say, it's very unlikely that the average person living in the DMV area has a highly functioning liver, highly functioning brain, highly functioning gut, highly functioning joint, because we're just living in an environment that's just bombarding us with toxins and oxidation and stress and eating on the run and just lifestyle. And again, we can go into details like that. So I think it's very important to understand that when we're giving nutrients into the body, it's obvious to think of food as calories, and that's fine. And food is nourishment. But actually what it is, that by the time the gastrointestinal system breaks it down, processes it, goes through the tight junctions in the gut, enters the bloodstream, it's no longer a food. It is a nutrient that alters electrical signals. That's the 21st century medicine. We're not waiting for the sugar to go high and the blood pressure to go high. We're not waiting for the hypertension, the diabetes, the heart disease. We are waiting. If we can look at the signals, we can kind of figure out what's coming. Okay, and we have the technology to alter those signals.
So I have a question. So you talked about this has a large dose of vitamin C.
Yeah.
So I showed you the vitamin C tablets that I take. So about how much more dosage is this?
Great question. So I looked at your vitamin C capsules.
Okay.
There were 1,000 milligrams. So you need to take 25 of those to match that. However, by the time your gastrointestinal system sees 7 tablets, 7,000 milligrams, you're going to get diarrhea.
Okay.
Your gut cannot hold on to it. IV means it's going straight into your vein, circulating around your system, being filtered by your kidney, and being urinated at. So that's essentially, it's that bolus, it's that large amount going straight into the vein that gives that electron effect, that antioxidant effect.
So is there any downside of getting an IV versus taking it? Like obviously this is not a natural way to intake some nutrients, right?
The simple way to answer it, this is not the ideal way to build up your vitamin levels. Your food is your primary way to build up nutrients. After you've eaten food, some people need to supplement with a vitamin. This is not compensation for the oral. This is just a different mechanism of action. Another way of looking at it is that if somebody has a problem, then you have to superdose the vitamins. You can do it orally, but there's limitations to orally. The perfect example is the vitamin C. There's only so much vitamin C you can take. So when you have a equation, a balance, and when you have a problem or an injury, then you have to, if you have a problem or injury, you have to boost your immune system, and this is the way to boost the immune system. It's not for daily consumption, it's not for maintenance. But if you are abusing your body on a regular basis, every time you don't sleep, you're abusing your body. Every time you eat the wrong food, you're abusing your body. Every time you have mental stress, you're abusing your body. The list goes on. Then you've got to boost yourself. So as I said, in the DMV area, it's not compulsory you do this, but then you must make sure you sleep on time. You don't put the wrong foods in. You put the right foods in. You sometimes have to supplement the right food. If you think you're doing well in those areas, you don't need something like this. However, I don't know about you, but I have a pretty hectic lifestyle. I was up at 5. I was working on things for a couple of hours before I came to work. When I finish my work, I'm going to go to the gym. After the gym, I'm going to take my kids to the park. So you get the sense that in a day, it's kind of hectic. And for some people, and I've grown out of it, is that when you're hungry, you'll just grab something. Right? And we're assuming that in a given day of work, there is some stress going on. Right? So you have to add it all up. So even stress has an oxidative effect. It's complicated. Right?
Interesting.
Yeah. So going back to the stem cells. Or what is stem cells? Stem cells are just innate cells which are just waiting. They're not doing anything. They're not multiplying. They're not doing anything. They're around your body. They're in your fat cells. They're in your bone marrow. They're all over your body, right? They're waiting for signals, namely injury. When there's an injury, and different parts of the body have different signals for injury, those stem cells know exactly how to change themselves to repair it. And so, to be strict, if you want to get stem cells, you have to go to the bone marrow. You have to go to the fat. And for the fat, you have to get a biopsy. This is laborious. It's invasive. The bone marrow is painful. It's invasive. But extracting it from your blood, we have to call it plasma-rich protein, which is rich with growth hormone, rich with immune cells. So when those immune cells and growth hormones are delivered to the area that is injured, the site of the injury is sending a signal to those PRP cells, and the PRP cells can divide in the form that it needs to repair it in a local area. Concentrated PRP in a focal area, rapid recovery, and the IV vitamin C will help you. The laser that I'm going to apply is a light therapy. It's going to hit the chromophobe of the damaged cells. By definition, things which are damaged have low energy. The chromophobe activates a phosphorylation, which is an energy pathway. The damaged cell now is energized, so it's going to heal faster.
So like my shoulder, which was diagnosed as frozen shoulder, I originally had, which was probably like 3 years ago, something like that. And I had a steroid shot, which made it feel fantastic for about 6 months. Then it went downhill pretty quickly after that. I got another steroid shot, felt great. About 6, 9 months later, it went down again. I may have even got another steroid shot again, same thing. Then I went to, someone recommended going to an acupuncturist. So I did that. Huge improvement.
Great.
And I still am shocked and not clear why
the mechanism may not be clear, but
but the results were very clear. And but I still have, like, when I exercise, so like I lift weights regularly, right? And so after I lift weights, this area particularly, like in that one spot on my shoulder, it gets more sore.
Right.
I have like less flexibility and range of motion, et cetera, than I do at my other shoulder. And so, ironically, I had frozen shoulder originally on my right shoulder, but that somehow got fully healed. But on my left shoulder, it's been years and it still hasn't been fully healed. So I'm interested to see, after all these attempts to get this thing,
oh, it's going to be perfect. But let me just dial back a little bit. So frozen shoulder, by definition, is stiff and the range of motion is limited.
Right.
And it's because there is potentially fibrous tissue, microscopic, inside the joint, and it's restricting movement. And the treatment for frozen shoulder really is physical therapy, which means moving it. When you move that ball and socket, you're smoothing it out. It's like you have an engine, and if you don't use it, it kind of seizes up.
So I was under the impression, like, there's this, what I was told was there's this like very light, thin capsule around your shoulder.
Right.
And frozen shoulder is when that thickens, kind of hardens and gets thicker.
That's an element of it. The more mobile a joint is, the more complicated it is.
Yeah.
The more simple, like a acromioclavicular joint, doesn't do much. It's very simple. So what you're describing is capsular, the capsule.
Right.
There's the labrum, that's cartilage around the side.
Yeah.
There's the cartilage inside. There's the movement. There's the synovial fluid. It's very complicated. It's
So you're saying frozen shoulder is more than just that capsule?
It's more than that. Yeah, that's a component of it. Yeah.
I didn't know that.
But so let's look at the bigger picture. Who commonly gets frozen shoulder? The people who don't use their shoulders in a good range of motion. The people that have repetitive movements, like conveyor belts.
So what I heard, the doctor that I went to told me that people that usually get frozen shoulder are middle-aged women, which is by far the highest percent, and then some athletes.
Sure. Well, what he's trying to describe, and I don't know whether middle-aged woman comes into it, is that because of the gender? Is it because of the age? Doesn't make any sense to me. But you have to look a little bit more globally. What is their environment that's creating it? The athlete, I'm going to guess. I'm going to say injury. I mean, athlete, injury. But if I speak common sense, you'll get the sense. How many athletes have frozen shoulder? And how many common folk in the population have frozen shoulder? A lot more than athletes. Right? Athletes may get premature arthritis because of injuries, but I don't know too many athletes have frozen shoulder. Again, that's an observation, but so common sense tells you that you don't have to be an athlete to have frozen shoulder. In fact, I have more experience to say that people who don't use their shoulder get frozen shoulder. And if you look at your past, beyond a year or so, you weren't as health conscious as you are now.
That's true.
So you really have to look at your environment then, which may have been more of an inflammatory environment, less than perfect dietary lifestyle, not enough sleep, stress, eating the wrong foods, things like that,
True.
which created an environment, and then the lack of motion may have been contributing to first frozen shoulder.
That's true. I didn't exercise.
Right, and now that you're better, the right shoulder is better, should we say, and the left shoulder got better after steroid. But let's see what the steroid is doing. The steroid can only do one thing. It's to blunt the immune response. By doing that, it reduces inflammation. It lasted for 6 months. But you didn't deal with the underlying process, so it came back.
Right.
You had the second treatment. It does what it's supposed to do. Reduces inflammation, amongst many other side effects that it potentially could have, like thinning the tissues around that area. So in fact, most orthopedic surgeons will only recommend 3, because after that, you have a higher risk of rupturing things, because you've just weakened the tissues. Oftentimes, we will do 1, 2, 3 steroid injections in joints we know are destined for surgery, so we have nothing to lose. We give people relief. We know the side effect is to thin the tissues and the joints and the ligaments, but we're going to do surgery anyway. But it's not a good idea to give too many steroid shots to young people, because you've now weakened the structure. So if you were to use that joint in a very forceful way, you're going to damage something, because the tissues were weakened and thinned because of steroids. Steroids have tons of side effects, even local. The number one is, as you're reducing inflammation, you're also thinning the tissues. You're weakening the tissue. Guaranteed, written in stone. Therefore, if you had a third one, that's it. Don't do any more. But it's still not dealing with the underlying process. So as I said, the environment could be inflammatory. As a result of inflammation, your body is depositing tissues to repair that inflammation. Those tissues are restricting the range of motion, and the less range of motion the less use of it, because it hurts to do that, I won't do it, is actually perpetuating the problem. And I gave you an analogy before, which I'm going to give you a repeat. Sometimes people's frozen joints, like a hip, I'm talking about older people with a lot of problems who don't use their joint, is so frozen, creating so many problems. We take them to the OR, not because we're going to do anything spectacular, just to knock them out. And we just forcefully yank that joint to movement. You know, it's like you have a door that's stuck, it's jammed. Once you just open it, it starts to move just fine, or much better. The joint is no different. So every joint was designed to move. Some people, they have to move because of the genetics of why. Other people, they're kind of lucky, they don't have to move as much, but everybody has to move. The definition of a stiff joint is one that doesn't move. It's not if, it's when. 20 minutes might be enough to make your joint stiff of not moving. It could be 2 hours. But you try to hold one joint, like when you fall asleep with your arms stretched out. After an hour, it's like, let me get that arm back and move it around. I've seen young kids have the same issue, because a joint was always meant to move, and much more often than you realize. So when you're in bed, you're actually moving. You're moving. So Again, in summary, frozen shoulder, the environment is allowing inflammation of some kind. As a result of inflammation, your body's trying to repair it. The repair tissue is no different than other disease processes, which we can go into next, is restricting movement. You not moving it is exacerbating the problem. You just moving it is the solution. Steroid is not the right answer. It would be a part of difficult cases where you've done the physical therapy and you've tried to move it, and it's not the first line. And it never should be. You're invading somebody's joint with a needle, has risk. You are putting a chemical into somebody's joint, has side effects. You're repeating it multiple times. Whereas what we're going to do is find out that the fact that you could have the range of motion by externally rotating.
I mean, now after the steroid shot, like
And
before I
internally
couldn't.
Sure. However, you still feel the pain.
I still feel a pain. Before
Right.
I had the original steroid shot, I had shooting pains going
Radiating.
down my arm, and I couldn't even sleep because of this.
So the pain that you're describing, because I said, can you put your finger on it? Generally, when you can put your finger on it, it's outside the joint. Inside the joint would restrict the range of motion, create pain, and inside the joint it will feel deeper, kind of constant. You know, I can feel it when it's in the middle of the night. When I lie on it, but you can pinpoint it. It means it's a local. So it's on the capsule. It's on a tendon that's going up around the shoulder. So it's a local area. We're going to treat it locally. We're not going to use steroids. We're going to use your own cells, which are rich in growth hormone and immune cells, just waiting for the injured signal to know exactly what to do. We couldn't have created those stem cells or those plasma-rich protein cells. Somebody else with a higher power created that. You cannot genetically engineer that as of yet.
And so, let's say you put those cells in this area where I have that, where it's tender and there's some pain there. Would it generally take like one shot of that, for lack of a better term, or would it take multiple? Or
so the principle is this: when it's an acute injury, quick treatment, resolution. Chronic injury may take more treatment. More severe, like you repeat it. Yeah, exactly. So your situation is 50-50 because it's so local. I think that you'll get a very good result after one. And if you get even a 60%, 80% improvement, you're on your way to recovery, so your body can do the rest. It's been chronic. Chronic, by definition, in the medical terminology, means more than 3 months. Yours is, granted, maybe even more than that.
Way more, yeah.
Yeah, but that was when you add the frozen shoulder and so forth. You may have only noticed this after the frozen shoulder got better, because at the time that you had the frozen shoulder, this may have been there, but you didn't notice it because the pain was everywhere else. That tends to happen. You solve one problem, then you realize you had another problem. You just didn't know it was already there. It's just that the other problem was bigger. It masked that one. So I predict that it's been going on a few months. So theoretically, I expect a significant improvement over 50%, and then a second one a week or two later. I usually wait a week because it takes up to a week to see the response. 2 weeks is as good as it's going to be. Then we can repeat it again. But it's not uncommon for me to do one shot, and people said this is great because I'm going to add the laser treatment. You have already cleaned up your lifestyle. I've just boosted your immune system. When you put it all together, you get much higher results than just the PRP injection.
So and I have friends, I've told people that I've had frozen shoulder, and people share their stories, or people in their family have had shoulder injuries and whatnot. It seems like there's a lot of people that get surgery and get steroid shots and get other kind of evasive methods. My question to you is kind of from your perspective, like a holistic, using these kind of methods, how much of that could be prevented, and more importantly, the end result? Is this result going to be better than doing surgery?
Absolutely. 90% of the time you can prevent the need for steroid shot, and maybe 95% of the time, 98% of the time, avoid surgery.
Really?
I'm going to give you my explanation. But let me start with a statement. When you're a surgeon and somebody presents to the surgeon having theoretically failed other things, which I'm going to go into detail, they failed because they didn't do the right things. Surgeon does surgery. You don't expect him to tell you how to change your diet and address the root cause. I'm going to explain that to you right now. So whether you're a tennis person with a tennis elbow, tennis player with a tight Achilles, or someone like me with tennis elbows and tight ligaments, whether you're a pro athlete and your injury won't get better, the main thing to ask is what was the environment that allowed it to take place? I'm going to give you an explanation. So when I had tennis elbow, I was always taught that it's because of repetitive use, like gripping too hard. It's because there's an imbalance in the dominant muscles and the less dominant muscles, and they're correct.
And just real quickly, what exactly is tennis elbow? Is it
Yeah, tennis elbow is basically in people who grip and who lock their arm. And when you grip, and you want the strongest grip is when you extend. That powerful motion is pulling on the part of the bone where all those muscles are connected to a ligament. And repetitive use keeps pulling on that ligament that's connected to the bone. And that bone is called the epicondyle, so we call it lateral on the outside, epicondylitis. Epicondylitis is inflammation. But let me tell you, my experience, no matter whether it's Achilles or the tennis elbow or the golfer's elbow or any frozen shoulder, there is always a reason for underlying inflammation. The mechanical component brought the problem out more readily. So in other words, if I had never gripped hard and did butterflies, I would never have got the tennis elbow. But the activity is not the cause. It brought out an underlying state. So when I have the person playing tennis and I'm telling them, I've done a blood test, and your immune system is overreacting to certain foods, which is setting your body in an inflammatory state, and then the activity is just bringing out the inflammation. And so on the tennis elbow that she had, I injected stem cells, she felt better. And the Achilles, she didn't want to do an injection, I just did the laser. But her statement to me was, well, I can't give up my eggs. Then you're not going to give up your inflammation. So I could do stem PRP injections and laser all day long, but you didn't deal with the underlying inflammation. So let me expand that inflammation for you just a little bit. It's very complicated, but I'm going to simplify it for you.
Can I ask you? So when I hear you talk, one of the things that I get out of it is that like inflammation is like the evil of health.
That's exactly what I'm going to tell you right now. That's to the best of our knowledge right now. Whatever we know now, in 1 year, 3 years, is going to be different. But what we know now, the prerequisite to all damage is inflammation. So let's go back to your frozen shoulder. As I said, the environment allowed inflammation. Your body tried to repair it. The repair tissue was fibrous, which restricted your shoulder movement. 75% of heart attacks are not blockages of cholesterol building up and blocking your artery. Really, a heart attack is where you have a little bit of cholesterol plaque. Looking at it, it looks little, but the biochemical makeup might be pretty unstable based on molecular size and inflammation. So when you have a little bit of cholesterol in your coronary artery, we call it a plaque. It's a living tissue. It's living. There's activities going on. It's responding to things. Complicated, but in the case where you have a heart attack, there's inflammation on that cholesterol plaque, making it unstable. When you have a scratch on your arm, you bleed. The blood clots to heal the scratch. Well, that plaque is a living tissue, which is, if it has inflammation, it's weak. If it gets damaged, your body knows exactly what to do. It's going to release platelets. That would be just fine, except there's not much space in the coronary artery. Those platelets clog up that artery. That's called a heart attack. So inflammation is the majority of the prerequisite to a heart attack. You shouldn't, people should know that, but many doctors don't even appreciate it. I'll use a conservative word. They don't appreciate it. They're still looking for the cholesterol blockage. That exists, but in a very small amount of time. So look, even if that was true, if 75% of your patients are getting blood clots in the coronary arteries because of inflammation, you should be looking for inflammation. And secondly, that's why aspirin works. Let me explain that. The studies show that you can't take aspirin and prevent a heart attack. There's no study that's been done or shown that. Once you've had a heart attack, if you take aspirin, there's a 25% reduction in a secondary heart attack. Because what does aspirin do? It stops the platelets sticking together as readily. So in the event that you have a next heart attack in process because of an inflammation, it's not going to be as severe. There's going to be a 25% reduction because the aspirin is keeping the platelets loose. See why aspirin, antiplatelet, is part of the picture of a heart attack, and heart attack is inflammation, right? So let me give you another one. Alzheimer's disease. We've been chasing the amyloid plaques. That's a protein. That's the end point. The protein is deposited because the brain is trying to heal something. We've identified inflammation in the brain, and it's the healing of the inflammation. If you don't heal it, there's going to be a problem. The deposition of the deposition of the protein, the amyloid, is not the disease. It's an observation, just like cholesterol and cholesterol plaque. They're an observation, they're an association, they're an innocent bystander. You have to ask yourself, what they found is that in a normal brain, there's a diversity of microbes. In an Alzheimer's brain, there's a preponderance of one type of microbe. It's called a micrococcus. So the body is, this is just hypothetical because in medicine, to say proven, it's a very hard final step. Even when we take a cholesterol pill, we don't prove that we prevented a heart attack or we treated it. We see that there's a benefit. So going back, when you have micrococcus, which the body is now going to respond to because there's an overdominance of a bacteria, as the body is responding, it's creating inflammation. And as the body tries to clean up the inflammation with special cells called microglial cells, that's like your cleanup cells, it does a good job. It goes to attack the inflammation, but the inflammation is around the nerve, so in the process of cleaning up the inflammation, is damaging the nerve. When you lose your nerve and you're depositing amyloid, you're getting dementia. So instead of trying to clean up the amyloid, instead of trying to look at the effect, you've got to look at the precursor, inflammation. So that's a little heavy duty, I get that. But I started off with the shoulder joint inflammation.
Yeah.
They're not all identical, by the way, but that process, that's what I mean. It's the early stages of understanding different types of inflammation, different parts of the body. But then, slam dunk, 100% cardiovascular, because that's where most of the research on the original inflammation came from. Time magazine, I think 5 years ago, said inflammation is the cause of everything. They were referring to the heart, really. Even though they knew that it was probably elsewhere, the stuff I just told you is cutting edge. I mean, like a year or two that we're now able to get into the holy grail of the frontier of the blood-brain barrier. It's not easy to just go get a sample from your brain. You can get a lot of sample from your heart. You can get a sample from your joint. You can't get samples from your brain. So the information I just gave you is pretty current. And it's got to be, it's not slam dunk, but it's now giving us an opening into understanding that, you know what, even in the brain it's inflammation. The joint is obvious, so let me make it simpler for you. So when you have arthritis, the itis means inflammation. Arth is joint inflammation. When you have colitis, the colon is inflamed. When you have, any itis in the body, tendinitis, inflammation of the tendon. So as I started off the conversation, almost all injury or almost all damage is preceded by inflammation. So if I was to give you the magic bullet, which there is none, but it would have to be in the form of finding ways to reduce global inflammation. That's why.
Yeah, so what I hear you, so in layman's terms, what I hear you essentially saying is what you consume, like you are what you eat. Like what you consume, it
impacts
really
your health. Yeah.
impacts significantly, right?
So I'll give you another example of that. Because I think that...
And not just what you eat, but your environment too.
Very
like everything,
yeah.
Whether it's a bad relationship or a good relationship or whatever.
So you see, the medicine is so complicated because there are so many moving parts. In medicine, we call it variables. We don't like variables because it's very hard to give 1 + 1 = 2. However, this is the real world we're living in. We have to understand it. So the next best thing is to get the study from this entity, like the heart people, this entity, the cancer people, this entity, the gut people. And for people like myself, we're in a strong position because I'm a primary care doctor. My job is to be able to be encompassing of everything. When you get the best information from all these very high level researchers, you put it together. And so that's where I'm going with this is that, so one of the examples I wanted to show you about inflammation, because inflammation is a very complicated field, but we're trying to simplify it. So people assume that if I'm never going to get diabetes, I can just eat as much sugars as I want. That may be true. If there was some guarantee that you're not going to be diabetic. However, you're not out of the woods. We have enough research to show that when you take a bolus of sugars, that means a large amount of refined sugars or sugar or something that's going to make your sugar go up, and if you're never going to be diabetic, that's okay. Your body has to produce a lot of insulin. So the more sugar you have, the more insulin. We call that a spike, right? Spike of sugar, but you're not diabetic, so you will have more than enough capability. We now know that the higher the insulin level, whether it's you making it or some diabetic taking shots, because, it doesn't matter what I eat, I can just take more insulin. Not so fast. Higher the insulin, the higher the inflammation. It's almost linear. Not for everybody. That's the problem about medicine. There are variables.
Right.
But that's one data point, right? I told you about the environment for frozen shoulder. I'm telling you the environment about the brain. We know about inflammation in the gut. You have to take all these variables and try to make the best algorithm to understand what I'm saying.
Yeah.
But so it is important to understand that there are things that create inflammation.
Yeah.
Insulin does. Even though, as I said, some people think that, I've had doctors say, don't worry about the diet now, you're on insulin. That's kind of old school, because they should understand the amount of insulin will impact the quality of somebody's health, because we know so much about inflammation, right? So let me give you another continuation of the diabetic story, just to make it profound. And we just slowed it down intentionally to keep our conversation going. Okay, this is very, very profound. So up until recently, only literally 2 years ago, it didn't matter how well we controlled the diabetic's blood sugar. They all had twice as many risks of there was twice as much risk of a heart attack than the general population. I'm going to repeat that word one more time. Doesn't matter how well you control the diabetic sugar, diabetics have twice the risk of a heart attack than the normal population. You should be astonished to hear that. Why are we wasting our money and time controlling sugar? Well, you're not wasting your time and money. Because if you control the sugar, we know that you have less eye problems, retinopathy. If you control the sugar, you have less kidney problem, nephropathy. If you control the sugar, you have less neuropathy, damage to the nerves. That's because of glycation. The reason we haven't been able to reduce heart attacks in diabetics controlling the sugar, because they have something called insulin resistance. It's fairly current data. Now that there's a drug for insulin resistance, which is good, I'm not against drugs, because it works on almost like a holistic way. It helps the gut and the liver and the muscle and the pancreas become more sensitive to insulin, so your body doesn't have to pump up as much insulin. Remember, high insulin, inflammation, heart attack. Insulin sensitivity drug, less insulin, less heart attack. That's exactly what the study showed. It's called GLP receptor agonists. GLP receptor agonists work at the gut level, and from the gut releases incretins. The incretins makes insulin become more sensitive. That means your body can just utilize it in smaller amounts. Smaller insulin, better result, you don't need as much. Your muscle, your liver, your pancreas, your gut, your adipose tissue becomes more sensitive to insulin, so your body doesn't have to produce as much. You don't have to take as much. Less insulin, less heart attack, because insulin creates inflammation. As I said, nothing is linear. We're not dealing with mechanics here. We're dealing with real human beings with lots of dynamic variables. But as the world is complicated, we also have lots of knowledge that we didn't have 5-10 years ago. You've got to be able to put it together and be able to putting it together. I call it an algorithm, but you've really got to be like a little ninja. You got to have eyes on your sides. You have to have eyes behind your head. You could have heard something 2 years ago. You could have seen something 3 weeks ago. You could have read something today, and all of a sudden, the light goes on. It's like, I saw something. You got to be a ninja. You cannot do medicine in a straight line. That's what the average doctor is doing, no disrespect, because we're stuck in this protocol medicine that insurance reimburses and the pharmaceutical is the only entity to treat. Are they really treating? The average person thinks of treatment as, I've been cured. I took my cholesterol pill, I'm cured. So I say, when you stop the cholesterol pill, what happens? The cholesterol goes up. Did you really cure it or did you control it? I take a diabetic pill, I'm cured. What happens when you stop the diabetic pill? My sugar goes up. Did you really cure it or control it? What happens when you stop the blood pressure pill? Did the blood pressure go away? No, you just controlled it. So you're cured. So to me, treatment means to cure it, or some way to do more than just control. That's what I'm talking about. That you have to really look at all the moving parts and understand that before blood pressure, before you even see the number go up, the blood vessels are lined by what we call endothelium, the lining. It's called endothelial dysfunction, not disease. Before diabetes, before sugar goes to a critical number, we talk about insulin resistance. And the warning signs is that insulin keeps spiking, but your sugar's normal. Don't worry about it. Worry about it. It's coming. Diabetes is coming, right? So inflammation comes before the heart attack. How many people have you heard where doctor told me my cholesterol is normal? 2/3 of people who have heart attack have normal cholesterol because the doctor's telling them they got a clean bill of health because they didn't look for inflammation. They didn't look for dense molecules. They didn't look for enzymes that are synonymous with inflammation. See where I'm going? So we've come like full circle, and there's so much more to talk about, but we started by talking about inflammation in the joint. Then I tried to bring you to saying that inflammation anywhere in the body, there's a reason for it. And even though the inflammation in the joint and the tendon has nothing to do with inflammation in the brain, there is some commonality. And I'm going to kind of stop on this note unless you have a good question, is that commonality is the gut system. When you're eating something and the body breaks it down, the microbes in your gut are trying to figure out what you just put in. You put in something inflammatory, it's going to send the signal. That's where it's coming from. When we see the signal, that's not the disease. That's the signal. We know what to do with it, but really change your diet. That's the number one thing. And conversely, when you put the good nutrient in, like we're putting the nutrient in, we're bypassing the gut really, but if you ate good food, fruits, rich in antioxidants, your gut will send the positive message, the antioxidant message, reducing inflammation. The others are pro-oxidant, creating inflammation. So they're not the same thing, but oxidation and inflammation are kind of synonymous. Antioxidant and lower inflammation is synonymous. Antioxidants you're rich in antioxidants in your fruits and vegetables.
That's great, thank you.
Heavy duty.